Hi, my name is Bailey Meister. The summer of my junior year, my dad was diagnosed with stage 4 mantle cell lymphoma cancer. With all of the treatments and trips to the doctors and hospitals, the nurses and doctors were always helpful and supportive to not just my dad, but my entire family. After seeing how much of the help the oncologists were to my family, it helped me realize what I want to do. I want to become a pediatric oncology nurse. I want to be like those nurses and doctors who didn't just help with treatments, but was also a light to my family during these times. Now, when I say I want to become a pediatric oncology nurse, let's break down what that is. Oncology is a branch of science and study that deal with tumors and cancers. The prefix onco means bulk, mass, or tumor, and the suffix ology means study. Millions of people are living with cancer or have had cancer. Cancer is the second leading cause of death in the United States. According to Dr. Mandel, about 1/2 of all men and 1/3 of all women in the United States will develop cancer during their lifetime. Oncologists have many different roles. Oncologists are medical professionals who practice oncology, and they're also known as cancer specialists. Different oncologists have different specific roles. They help diagnose different cancers, help in the staging of the cancer, and the grading the aggressiveness of the cancer. They look for symptoms like fatigue, weight loss, unexplained anemia, fever of unknown origin, and many other different symptoms. Depending on the type of cancer, oncologists use different diagnostic tools like biopsies, endoscopies, CT scans, x-rays, MRI scans, ultrasounds, blood tests, or other scannings. Based on the grade and stage of the cancer, oncologists help plan a therapy that is best fit for their patients. This could be surgery, chemotherapy, radiation therapy, or other form of therapies. Cancer has evolved over time. The growth of knowledge in cancer biology has led to progress in cancer prevention, early detection, and treatment. Scientists have learned more about cancer in the last 2 decades than all of the centuries before. The American Society found that during the 1970s, about 1 in 2 people diagnosed with cancer survived at least 5 years. Now, more than 2 of 3 people diagnosed survive that long. Today, there are more than 14 million cancer survivors in the United States alone. Some of the ways cancer has evolved is having more targeted therapy, immunotherapy, learning more on cancer genetics, nanotechnology, robotic surgery, and expression profiling. Even with cancer evolving and medical professionals learning, there's so much more that oncologists don't know yet and are still working on discovering cures and treatments for some cancers. Overall, oncologists have made improvements in developments and research and techniques over the last few decades. They have learned new ways to detect and prevent cancer growth. Oncologists work to help patients in treatments, but also help keep morale and help with anything families need. This is why I want to work in oncology when I graduate. Thank you.